Joy Bakri of UNAs was supposed to come and moderate this session. We still haven't seen him. And we are supposed to have 3 speakers for this session. We have 2 speakers. We don't have the speaker from Cameroon, but I think I will start all the same. As I did introduce myself, my name is Emila Samode. I'm the manager for the plenary hall, but since I don't have a moderator, I'll be moderating this session. Unfortunately, I don't have the CVs of the speakers, so what I'm going to do is to invite the speakers, and when they come, they will introduce themselves, and then I'll make their presentations. So it's my pleasure to now invite Mr. Wayne Otieno from Kenya. He will introduce himself and then make his presentation. Wayne.
Good morning. Good morning. It's like we didn't take tea in the morning today. Yeah, so as you said, I'm Wayne Otieno. I come from Kenya. I work for Catholic Medical Mission Board, CMMB. And I have a short presentation, an abstract presentation, which I will be taking you through. I've seen it has been put on. Yeah, so are you the translator? Are you there? Okay, thank you. Yeah, so the abstract is titled Amplifying Voices, Enhancing Beneficiary Experience via Virtual Anonymous Feedback for Adolescents and Young People's Program in Siaya County, Kenya. And I was the author, and I also have my co-author here, Hilary Ngeso. All of us are affiliated to CMMB. Yeah, so you realize, and the discussions that have been going on throughout the week, you all remember that the issue of accountability to AYP programs, especially services provided to the adolescent and young people. Beneficiary feedback mechanisms are really very, very important to improve on accountability and service quality. But then adolescent programs often lack that robust feedback mechanisms. And this was even worsened by the COVID-19 pandemic. It even disrupted the traditional mechanisms of providing feedback in the remote setups. And so we saw there was need to sustain provision of those services in the context of, in such context, just to rethink traditional service delivery models, just to meet the current mechanism, because pandemics will still come. So we need to be prepared. Yeah, so in this case, we came up with the virtual anonymous feedback platform that was initiated for AYP in mentorship sessions for individuals to provide feedback. This was a global fund program, HIV program, which CMMB is implementing in the rural setups of Kenya. The goal was to improve service quality and make them responsive to the needs of the participants during the pandemic through this feedback platform. Next slide, please. So we collected feedback for just participant experience or from participants attending mentorship sessions for adolescents and young people who are dealing with the age of 15 to 24 years. This feedback was anonymized, which means no one could know who submitted what, but you could get the content. So it was collected from this participant through an online self-administered form that was anchored in the Kobo Collect platform. And so since they were using a smartphone, participants with smartphones assisted those without, just to allow them to alternate in using the same phones to fill and submit the forms. But in cases where they were insufficient form, they could not access the smartphones, we also had a feedback box called the sharing without shame, where they could put the physical forms, fill and put there. So the feedback was sought, including was about their session experience, the content of the sessions that they attended, what do they want us to improve on, the facilitator experience, and challenges that they encountered. So at least 348 participants who attending the sessions were able to provide feedback through this platform on a rolling basis within the course of the 5-week mentorship program. So the feedback we received, of course, was we were able to utilize it to improve the mentorship sessions experience through discussion with mentors. And we generated some descriptive statistics that we want to share with you here, and interpreted them just to see what we do with them. So some of the findings we had, you will recall that I'd said that these are the people who are targeted mostly with these mentorship sessions were GYWs. And so it was just a fraction of the boys, young boys were allowed in, but majority of the participants were GYWs. And so that explains why most of the people provided feedback were females at 76.3%. And when we compared these participant attendance consistency in their mentorship sessions, if you compare the previous one before we began this innovation and after the innovation, we were able to see an increase of 66% to 97.3%. And with all of them present at the scheduled start time, which is very important because we need all of them to begin the sessions. And there's also a high percentage of 99.2% of the respondents experienced appreciation for ease of access to the session venues because we were able to put them the nearest places where they live. Yeah, so notably for ease of the comfort participation in the session, at least 18% of the participants requested that we could increase the proportion of males attending the sessions. And these ones were young girls requesting for this because they were thinking their fellow brothers at home were also affected by one or two issues that they were being taught about. And additionally, there were requests for the provision of dignity kits, particularly for girls from the vulnerable households. Next slide. Yeah, so the perceived quality of sessions and internalization of those sessions was really reportedly high, generally high with specific feedback given, and that feedback you can see we have at least 99.43% reported having adequate time for learning and asking questions, and 34% suggested that we could improve on time management, especially for the participants. They felt some of their colleagues were coming late for the sessions. And 99.43% again recommended scaling up the interventions to reach more adolescent and young people. And you can see there's a pictorial of a questionnaire that was used, and with the consent form, the consent part that they had to read and consent whether they wanted to participate in this feedback or not. Yeah, so it was voluntary. Next slide. Yeah, so what did we do after collecting all this? Because the point is for you to hold people accountable, the duty bearers accountable. When you collect feedback, you are supposed to use it to do certain things. And this is majorly what we are sharing, how feedback mechanism can be used to improve the adolescent youth program service delivery mechanisms. And from the feedback that we got, at least we realized that we needed to be more vigilant on what happens into the field now that we could not be present in everything that was happening. So there was a a discussion and an idea that we brought on board. We introduced a live share technology. Live share technology is embedded on our WhatsApp platform, so it can be used in low resource settings. You don't need a lot of investment to use it, provided you have a smartphone and you are able to form a WhatsApp group. You are able to use this and do a remote monitoring of the field-based sessions. This idea, this innovation was also presented in the International AIDS Society conference sometimes back. We were able to write about it, and because it has been very, very instrumental, and it came as a result of this feedback mechanism. Yeah, then there was also the issue that we shared the feedback with the facilitators. If in case maybe the participants shared that they felt the facilitator was not giving enough, we could hold one-on-one engagement with such facilitators just to bring in corrective mechanisms to participant feedback and improve the experience that they have. In some instances, they were requesting if we could integrate the biomedical services, especially clinical services, HIV testing and STI screening alongside the sessions, and not just as separate activities, or telling them or referring them to the facility. So we could bring in service providers to the facility to do this testing. And we streamlined the process also of targeted provision of dignity kits. I think from this feedback, we've provided a lot of dignity kits to adolescent and young girls from the rural communities. Yeah, and based on the complaint the young girls put forth about increasing the male participants, we were able to increase that ratio from previously what we used to do in the Global Fund program of 80 to 20 rule, at least 8 in a class of 100 participants, 80 girls and 20 boys. We were able to reduce that to have 70 girls and 30 boys. And I think that has been able to work well. Yeah, so what we conclude, in short, what we're sharing is that beneficiary feedback mechanisms are really, really vital to the response of the health intervention, especially in times of emergencies and pandemics like COVID-19. You still have to hold the duty bearers accountable, even when you are not able to move around because of the pandemics. So such very low cost, innovative and cost-effective approaches are really essential in enhancing the accountability and just ensuring that we bring voices, we amplify the voices of the adolescent and young people, because even in this conference, they've been saying their voice, they are not being heard. So we are giving them a platform to be heard. As with the Clarion call, they always say nothing for them without them. It's really automatically against them. Yeah, so online feedback mechanisms do offer very anonymity and fostering the sharing of raw, very authentic and information that we can use to enhance program impact. Next slide. And of course, I wish to acknowledge Global Fund, the Kenya Red Cross Society, and Catholic Medical Mission Board, and of course Kenya, and the other logo you see there is for the Siaya County government, which is a subnational government in Kenya, for the cooperation and the stakeholder engagement we've had to ensure that we give good services, quality services to the community that we serve. Thank you so much.
Yeah, thank you very much, Wayne, for that clear and interesting presentation. To make sure that we are on the same page, Wayne, when you talk about dignity kits, can you just tell us what they are so that we all understand what you're talking about? Some of us in the room may not really understand what you mean by those kits.
Okay, sorry for that. I didn't define that. I thought I was talking to Kenyans all, only to realize that we are of diverse backgrounds. So dignity kits in this context means a lot of basic things that the young girls need, like the sanitary pads. Sometimes some girls do not even have the necessary towels. They are not able to afford even the soap, the sandals. Yeah, so it's a package of a lot of things, including the lassos, uh, and so many things, like just even having a notebook. So that bag has got a package of so many things in it that they are able to use as young people. Yeah.
Thank you very much. I will now invite Mr. Isaac from Nigeria to make his presentation. Please introduce yourself, and then you can talk to us.
Good morning, all. My name is Isaac. I'm from Nigeria, and I'll be making my presentation. It's been amazing 4 nights in Zimbabwe, and I've been eating a lot of salsa. I hope at the end of the conference, I'll be made a citizen of Zimbabwe. All right, so this is our project, When Showers Ignite Passions, a riveting exploration of rainfall, risky encounters, and the youth refugee experience in West Africa. And I did this study with my colleague, Molly Uno. Next slide, please. All right, so a quick one. This research was part of a project that was funded by the International Aid Society through their Youth Hub Seed Grant. And then the funders had no influence on the work conducted. Yeah, next slide. The need for HIV prevention in humanitarian setting has been more pressing than ever, particularly among young refugees. And as of 2019, we have over 70 million people who were forcibly displaced worldwide, and over 25 million of them were refugees, and over half were children under the age of 18. So our study formed a crucial part of a project funded by the International Aid Society. And so to give a background of what the project is all about, we established a physical hub in the largest refugee settlement in West Africa. That is the Adagom refugee settlement in Cross River State, Nigeria. The settlement is made up of 40 communities, and there are about 20 to 24 households in each of these communities. So our study delved into qualitative analysis of the relationship between rainy season and unprotected sex. Next slide, please. So our aim was to uncover factors contributing to this phenomenon and its implication for HIV/AIDS prevention. This study is part of a broader study we conducted during our project, and so it's a small part of it. So next slide. Our research design, the methods, we use a qualitative research approach with in-depth interviews with our respondents and focus group discussion. And we use our purposive sampling method to select the young refugees aged between 15 to 24. We collected our data during the rainy season for real-time experiences, and we use thematic and inductive analysis focusing on sexual behavior and the influence of the rainy season. Next slide. So some of the questions we use in eliciting responses from our respondents include the following: the sharing of specific events or patterns related to increased sexual activity during certain weather conditions. Also, we discuss cultural influences on the relationships and intimacy, especially during or after rainfall, and how this may contribute to the challenges in addressing HIV prevalence within the youth refugee population. Also, participants' experience with assessing healthcare services and specific challenges for young people in assessing HIV prevention and treatment were also discussed. Next slide. So for our results, we had a total of 30 participants took part in the qualitative study, and then we had 18 female, which represent about 60% of our participants, and 12 male. Next slide. So some of our key findings, we could see a complex interplay between factors that leads to increase unprotected sex among young refugees during the rainy season. And then some of the participants' perception was what we have on the board: narrow sex, the sweet pass for rain, and this simply means that they enjoy having sex unprotected during rainy season. Next slide. Also, some of the perceptions from our respondents, guys know they feel control body inside rain, which means their male counterpart partners cannot use condoms, or they don't use condom during rainy season. Also, rain time now weather for two. No, please, previous slide. Rain time now weather for two. If you no get Odeshi, I no fit carry raincoat. And this is very, very interesting because Odeshi is a Nigerian word for like bulletproof. And so in the settlement, the young refugees tag implants, contraceptives as Odeshi. And so if a lady does not have that, they don't care. They have to have the sex unprotected. And another interesting findings we had was when everywhere cold, it's not easy to stand up to carry condom. It means when the weather is cold, it is not easy for them to access condom and the likes. Next slide, please. So some of the interesting challenges we also identify in this population is that they have limited access to sexual and reproductive health services. And so during rain time, there's increased indoor time, and this leads to sexual encounters because they are always indoor. And we also look at some cultural factors, socio-cultural beliefs and practices related to rainy season. For example, transactional sex. There is an unequal power dynamics in the settlement, and so the female in the camps tend to engage in some of this transactional sex, and also absence of sex education. The community is quite sensitive to the discussion of sex education among young people, and so this affects their understanding of how they can access some things and how they can access contraceptives or even condom in the community. And another thing that I would like to mention is the issue of hardship, because in each of the household in the refugee settlement, they earn less than $70 annually, and so it is difficult for them to want to purchase condom. That is a lot of money compared to what they earn. Next slide, please. So in conclusion, the need for youth-focused, culturally sensitive HIV/AIDS prevention strategy in the settlement is very paramount, and our recommendation is that we need to address challenges that is being posed by rainy season and socio-cultural belief in the settlement. Also, interventions and access to condoms need to be intensified during rainy season in this settlement. Thank you. And next slide, please. This is a barcode that leads to a short 2-minute documentary about our project. For iPhone user, you can scan, and then for Android user, you can just go to knowledgeactionhub.com, knowledgeactionhub.com to learn about the project. Thank you.
Thank you very much, Isaac. I was informed by the IT colleagues that Joy may be online and wants to make a statement. Is that correct? IT colleagues, is he online? Are you ready for his quick intervention? If he is, please go ahead, IT colleagues.
Hello, dear colleagues. Can you hear me? Hello, can you hear me?
Yes, we can hear you.
Thank you very much, my dear colleague, for stepping in at the last minute, and apologies to everyone for my late coming in. Some IT issues. As you can see, I am teleworking and so moderating this session as much as I can from Geneva, where I sit right now. And it was great to already listen to the presentations of Otieno and then of Oga Isaac. Very interesting. So to my colleagues, so I didn't get your name, was helping me. I would need your support to help me to moderate this, because I am not on the site to know what are the latest development. But what I can see, I mean, we would then need to give the floor to Mr. Claude Ngwayu Nkfusai from Cameroon for his presentation. But as Mr. Claude come to the podium, I would want to have a question to Isaac, Oga Isaac. What has been the recommendations, as so far from the, from your project, and have those recommendations been taken to action by the local authorities or implementing partners? Could you address this, Isaac? Thank you.
Hello. All right. Thank you so much for your question. One of the things that we learned from the study is that it also helps us to tailor the project properly, so we could know the kind of intervention we need to offer to the young refugee. And then in following those recommendations, we also had to partner with some local organizations in Nigeria to help with the sustainability of the project. And then we use a quite a unique model of peer-to-peer learning in the refugee settlement as well, so that these young refugees can take the services into their hands. They better understand their own situation. So we educate them as peer educator, and then we look at the most active participants from the project who were in charge of, they are in charge of the hub we set up in the community. So they tend to offer those services to their peers continually. And we are still seeking for more partnership from local organizations to keep in regular supplies in the settlement. Thank you.
Well, thank you very much again, Isaac. And I must say, your title is a very flowery title, and I'm sure it raised, a lot of attention even before you make the presentation. So, unless I'm mistaken, shall we now hear from Mr. Claude Ngwayu Nkfusai from Cameroon?
Unfortunately, he is not here. So we've had two presentations from Isaac and from the colleague from Kenya, who is Wayne. So I am now going to turn it to the participants to see whether they have some questions and some contributions. So colleagues, we have about 10 minutes to go. I will now invite you for your comments and questions. Do we have roving mics around? Please raise your hand, introduce yourself, and then you can make your comment or ask your question.
Good morning, everyone, and thank you so much for the wonderful presentations. My name is Sylvia Odhiambo from Kenya, and I want to direct my question to Felix. I actually have Wayne, sorry, I have two of them. I like how you did beneficiary feedback, but I'm wondering if there was any variations in response between the feedback that were done online versus the ones that were handwritten. And two, if you went further to really look into if the feedback mechanism actually improved program participation and perhaps even retention in the program. Thank you so much.
Kindly repeat the last question.
If the feedback mechanism improved program participation, because I understand the objective was to improve quality of services, did that result into improved participation and perhaps even retention if it was a long-term program? Thank you so much.
Can we have the next question, please?
Good morning, everyone. My name is Olaide Akoni. I'm from Nigeria. Thank you, Isaac, for your presentation. Just a bit curious. Beyond the focus group discussions and the outcomes from the feedback from the participants on the need for condoms and all of that, are there plans to do regular education for the young people? Because it seems like having sex is the way of life in the camps. Yes, they're in IDP camps and all of that. Are there planned interventions? Because I know you said this is just part of a larger project. So it would be good to know what else is planned beyond provision of condoms. Thank you.
Thank you very much. Can we have the next question, please?
Okay, thank you. My name is Wadane Munyama from Soin Power, Zimbabwe. I want to ask about the dignitary kits. How sustainable is it to provide the young people with dignitary kits?
Thank you very much. Can we have the last question, if any? Okay, in that case, Wayne, you have the floor.
Merci pour la présentation.
That's a
Je
question?
suis de la RDC Kinshasa.
Okay.
Dans mon pays aussi, il y a les cas de échanges de rapports sexuels avec le mineur qui se trouve dans les camps de réfugiés. Alors, je demande qu'est-ce qu'on peut faire en cas des responsables qui distribuent la nourriture dans des camps de réfugiés, échangent une partie de la nourriture avec les rapports sexuels avec des filles de moins de 15 ans. Merci.
S'il vous plaît, vous pouvez répéter la question?
Je dis ceci, la présentation est intéressante, mais dans mon pays, il y a des enfants qui ont moins de 15 ans, souvent dans des camps de réfugiés. Il y a échange de la nourriture avec un rapport sexuel chez les enfants de moins de 15 ans.
Donc ça, c'est un commentaire ou bien quoi? Une question. Je n'ai pas bien saisi votre question. Ok, on y va.
J'ai dit ceci. Chez moi, dans les camps de réfugiés, il y a les enfants qui ont moins de 15 ans, les filles.
Oui.
C'est souvent ceux qui partagent la nourriture.
Oui.
Échangent les rapports sexuels avec une partie de nourriture avec les enfants. Qu'est-ce que je dois faire?
Okay, that's fine. So he is saying that in some settings there are children who have sexual intercourse in exchange for food. So what is it that we can really do in that situation? All right. Wayne, you have the floor. The questions that came to you, yeah.
Okay, thank you. I'm not sure whether the second last speaker asked me the question or you're the one. Okay. Yeah. I will tackle about the question whether there was any significant difference between the online feedback and the paper-based feedback. I want to say that most of the feedback that we received, the AYPs were using the online platform, and this was mainly because in a class, if you could find at least 4, 5, or 6 AYPs have got a smartphone, then they could use it alternately. There are very few cases where we had the paper-based feedback, and in most of the cases where we had the paper-based feedback, it was about if an adolescent wanted to express the violation they had encountered, like the sexual gender-based violence, the rape or the defilement cases. Yeah, so that was at least if they wanted to express more stories about themselves. The other thing is about this initiative really helped improve the quality of sessions that we had and even the retention, because previously, as I'd said, there were issues of participants dropping out, probably because of monetized sessions, or maybe they were not feeling like they were getting the quality of services that they needed. But because of the feedback, we were able to customize to their needs, and it really improved the quality of service delivery. In there are cases where we have even had to adolescents who refuse to be interested in crowds. They could easily say what they wanted, and the services it is patient-centered care. Thank you.
Thank you very much, Isaac.
For the first question on plans on education, so the aim of the project actually started with the education program. So we trained them as peer educators to go into their community. So we selected them around the 40 communities within the settlement. So we have representatives from each of those communities. So we train them as peer educators. Then they go back into their community to train their peers. So that is the main aim of the program. So we are very big on education. Yeah. And then to the second question on transacting sex for food, sadly, it is the reality. It is something that is very common. And then when we're doing our project, another thing I got to discover was that they were actually entitled to some monthly stipend from the UNHCR. And because of that, most of these, the parents even push their kids like to have more children so that they can get more of this monthly stipend from the government. So it's really sad. So one thing we are doing with the ones we are working with is to also empower them to have some skills. We are partnering with a tech company to also give them some basic tech skills alongside our HIV prevention projects. Yeah, thank you.
Thank you very much. Joy, are you still online? Do you want to make some concluding remarks?
Oui, merci, cher co-président. Je prendrai la parole en français en espérant que la traduction est proposée, sinon je vais aussi parler en anglais. C'était juste pour... je voulais remercier tout le monde pour les présentations. Je pense que c'était encore une autre session très importante sur la question de la prévention. Mais je voudrais aussi rebondir sur ce que la collègue de la République démocratique du Congo a soulevé comme son problématique. C'est un crime, il est criminel de proposer des échanges sexuels comme transaction pour la nourriture, quel que soit le contexte, en particulier dans les camps de concentration, quel que soit l'âge. Je pense qu'en plus de ce que notre collègue Wayne Otieno a partagé, il est important aussi de rapporter la première chose, c'est de tirer la sonnette d'alarme, c'est d'informer les organisateurs qui sont responsables de cette provision de nourriture. Je crois que la première chose, c'est d'informer et d'alerter. Je crois que cela est capital. Sinon, otherwise, to conclude, again, thank you all colleagues and participants for this session and for the speakers. We hope you enjoy as much as I enjoyed the discussions. And I'll hand over to you back, my colleague co-president, for the final words. Thank you for thinking of me. Thank you.
Merci beaucoup, Joy, pour vos commentaires. So, colleagues, we have come to the end of the session. Let me once again, on your behalf, thank the two speakers for those very interesting presentations, and to you, colleagues, participants, for your active participation. The session is closed. Thank you very much.